I'm Megan Smith, and I am the Principal Investigator for this TRI pilot application for 2017.
And I'm Rachel Stafford, one of the co-investigators for this project. We're both assistant professors in the Department of Pharmacy Practice for the UAMS College of Pharmacy.
That's correct. So we are pharmacists, and we are excited about the profession of pharmacy and how it's changing among healthcare reform. Specifically, we're very interested in community pharmacy. Now, community pharmacy has a history built on a commodity business around medications. However, with our advancements in education, we can do so much more. For example, community pharmacists are now regularly providing immunizations, medication therapy management, disease state education, and more. Training to become a pharmacist requires 4 years of pharmacy school beyond the undergraduate coursework, and that results in a doctor of pharmacy. Within the pharmacy curriculum, students learn about medications, of course, but they also learn about patient assessment, how to evaluate patients through performance of tests like physical assessment, health screenings, and lab data. They assess the need for treatment and referral and identify patient-specific factors that affect health, medication therapy, and disease management. Pharmacists can also choose additional training through residencies and board certification in a specific practice area.
One of the innovative services being offered in community pharmacies is point-of-care testing, and one that you may already be familiar with is a test for blood glucose, an indicator for diabetes. Two that we're specifically interested in for this project are point-of-care testing for influenza, the flu, and Group A streptococcus, or strep throat. Treatment for influenza infection is best if initiated within the first 48 hours to help reduce symptoms and complications. Offering screening and treatment for these two common illnesses in a community pharmacy could result in quick identification of illness and treatment. Patients with early symptoms of influenza and strep throat commonly wait to see if their symptoms worsen in an attempt to self-treat before seeking medical care. This often leads to patients with influenza missing the treatment window. Community pharmacists are in a unique position of identifying these patients seeking over-the-counter medications. The community pharmacist can triage if the patient has the flu or strep throat and can provide rapid tests if indicated, ensuring that the patient doesn't miss the treatment window. In addition, the community pharmacy setting is ideal for early identifications because most Americans live within 5 miles of a community pharmacy, which provides a greater access point to patients who need treatment.
So we know that early identification for these diseases is necessary, and we know that Americans live close to a community pharmacy, providing accessibility unlike anything else. So the goal of this project is to figure out how to get more pharmacies providing these services. We know from 3 studies that were published just in the last 2 years that providing influenza screening and for strep throat screening is possible in the community pharmacy setting, and that it's effective at both identifying and providing treatment to the patients in need. We also know that, however, in Arkansas, we only have 1 pharmacy that's currently offering influenza screening. However, we have over 160 pharmacies in the state of Arkansas who already have the legal requirements ready to go in order to provide this service from today. So they could start serving these patients today and they may not even know it. So how do we get more pharmacies to provide these services? One of our national pharmacy organizations actually developed a certificate training program in order to help spread the word and train pharmacists that they can do this and that they have all the resources available to them already. What we don't know is how effective is that training program in actually getting services off the ground. The training program is pretty intensive with 8 hours of home study, or 8 hours of a live program and 12 hours of home study on all of the regulations, refresher on all of the disease states, as well as the skills needed to provide these point-of-care testing services for influenza and strep throat screenings. So we want to know, and that's only been going on for about 2 years. These trainings have been offered, about 30 or so have been offered nationwide. And we want to know, is the training alone enough of a catalyst and enough of what's needed in order to further implement these services in community pharmacies? Or are there bigger barriers at stake here? Are there other things that are preventing pharmacies from providing these services? And so we want to test whether or not the training alone is enough versus maybe a bundle of other implementation support, such as additional resources, or is it cost a barrier, or to understand really what's working and what's not working for a community pharmacist. And we need your help. Your support will enable us to provide additional resources to these community pharmacists who are piloting this in Arkansas. We also are wanting to discover what was really useful for them and what they need to succeed. In other words, should we continue to put our focus and our efforts into additional certificate training opportunities, or perhaps focus on a bigger barrier that they are facing? If these research proposed aims are achieved, then our next steps are to test specific strategies head-to-head in a larger scale, and also we're interested in the physicians' perspectives on working with our community pharmacists.
So how will we do this? We're going to use a two-phase approach in order to evaluate the impact of certificate training course and additional resources. The first certificate training course was delivered in Arkansas on September 29, 2017. From this training, we recruited 10 pharmacies to partner with us in our research. The first phase is to get an idea of the impact of the training course alone. During this time, no additional implementation support will be provided to the pharmacies. The goal is to assess whether training alone provides sufficient support for implementation. At the end of phase 1, we will measure number of pharmacies who implemented screenings, number of patients screened at the community pharmacy, number of patients who tested positive for flu or strep throat, time to treatment, and how treatment was obtained. Then, in phase 2, all pharmacies will receive additional implementation support, including a resource guide for strategies to obtain treatment, funding for screening supplies, and consumer marketing materials. At the end of phase 2, we will continue the same measures as in phase 1. We'll also conduct interviews with pharmacists from each pharmacy to determine the helpfulness of the training program versus additional implementation supports, what worked and what didn't work, what problems they encountered while trying to implement services, and what additional resources they feel like would have been helpful during the first year of the implementation.
So in summary, community pharmacists are expanding their services beyond traditional dispensing. With the point-of-care testing services we have described in this proposal, we have an opportunity for a great public health impact by keeping patients out of the hospital due to influenza or strep throat and all the complications that could come from both of these conditions. Pharmacists are trained to provide the physical assessment necessary to triage patients with these conditions. And we already have the legal requirements in place to begin offering these screenings today.
With this project, we want to increase the number of community pharmacies providing this service to our patients, as well as find out the best method that enables them to do so.
This project will set us on the right path to greater implementation for influenza and strep throat screening for a healthier Arkansas.